Okay, hello again, students. A short video today on the skill of immobilization. We're going to be doing immobilization of a fracture, an arm fracture. This is most likely the one that you're going to have as your skills final for this class. And for this, if you'd like to try and do this along with us, you'll need some of the following equipment. Up here on the table, you first of all need to have a roll. This can be a roll of just about anything, something to put in somebody's hand like this. It can be made of any material. This here, a cravat or triangular bandage. Triangular bandages, you either can get those prepackaged or you can make them yourself, just cut off a corner of the sheet. Some sort of splinting material. It can be board splints, it can be rolled up plastic, it can be cardboard. This happens to be what they call a SAM splint. It's a piece of metal that's coated with some vinyl to make it more comfortable, and it molds to the patient's arm. It's comes to us from the military. Then you'll need 2 small strips of cloth and 1 long strip of cloth. If you were watching the video on tourniquets, then you can take the tourniquet that I used on Lucy and you could use that for your long cloth right there. All those things are going to be in the skill station. You should have your books that have your skills in them, and the one that says immobilization, fracture immobilization, long bone splinting. That's the one that you want to use. Follow along with that sheet because we'll be using that sheet to do the testing. So the first thing that we're going to do, get this out of the way, with any of our skills is make sure that we have our body substance isolation on, so gloves on. Make sure you say, hey, my BSIs are on and is my seat safe? And when the answer is yes, the first thing that you do in this skill station is you have to order the immobilization of the injured arm. Now we're going to give Lucy a broken right forearm, so we're going to have her stabilize it. We're going to say, okay, here, hold that up against your chest and stabilize it. Now, she could do that as the patient, or my imaginary partner could do that and stabilize the patient's arm. The next thing that we're going to do once the stabilization takes place is check MSP. So check for a pulse, say, can you wiggle your fingers? Go ahead. Yeah. Okay, which finger am I touching?
The thumb.
Okay, so we have MSPs, motor sensory and pulse established in that extremity. Then we have to find our splinting material and measure it. So we find this splint right here and I measure it against a good arm to make sure it's going to fit. Okay, that'll work fine. Then while she's stabilizing, keep stabilizing there, we're going to apply the splint. So you're going to apply the splint by just sliding it underneath. Okay, and hold on to it there. Okay. And now the splint's in the right place. We want to secure the splint by taking strips of cloth and secure the joint above and below the break. So she's got a forearm break right down here. We're going to put 1 tie, and don't tie any knots you can't untie, otherwise you have to use scissors. There's 1 simple knot right there, securing her elbow or her wrist, and then 1 here for her elbow. Just keep holding that arm right there, like that. Here's the point where everybody gets confused, and that's how to put on this triangular bandage, this cravat. When you open up the cravat, it makes an arrow. Okay, right now you can see that this arrow is pointing towards Lucy. Now I want to point the arrow in the same direction that her elbow goes. So her elbow is pointing towards me, so I want this to point towards me as well. Once I've got this to where it's pointing towards me, now I have this in the right place. Take the end in the middle and tie a little pigtail. Just a little pigtail like that, and that's going to make a little cup inside the triangular bandage. And when I want to replace my fist, that cup that I've made, with her elbow right here. So this will take on the inside. Okay, and again, I'm not gonna tie any knots that are too complicated in the field. Of course, I would tie a much more secure knot than I'm gonna do here. Now you notice this is supporting her arm. That's what we wanted to do. I tied it over her, on her uninjured side. And now we take the long piece. This is the sling, this is the swath. When you put a swath on, the right way to do it is to instruct your patient to put up their uninjured arm. My microphone's getting caught here. All right, so her uninjured arm is up. I'm going to take the swath. I'm going to go right over her like this. And as I bring the swath around the front, I'm going to try and catch right underneath the wrist. So under her wrist, over to this side, and then we tie it off with a simple knot over here. Make sure when you do this, you don't tie your patient to the chair. Okay, you put your arm down. The last important step in this is putting the hand in the position of function, which really seems kind of silly, but you take this roll and you're going to say, okay, put this in your hand and hold it. See if we get a better view of that. Okay, see how she's holding that? That's called putting it in the position of function. If you look down in the critical failure section of the skill sheet, that's a critical failure. If you fail to put that roll in her hand before you finish the station, then you failed the station. And this is probably the thing that most students fail to do when they do this skill. They either get screwed up with putting on the sling, or they end up not putting the hand in the position of function, and then that it means a critical failure there and you failed the station. You don't want to do that. Now, once I've got her hand and arm now, she's got the position of function and she's all splinted up, I'm going to recheck my MSPs. So motor, sensory, and pulse, check to see if there's a pulse, see if they can move their fingers, see if they respond to light touch. Once you've done all that now, you've completed the station. That's the more than likely is going to be the skill and the particular injury that you're going to have to do for the registry skills. It's one of those that are called random basic skills. And the random basic skills are joint immobilization, long bone immobilization, CAD, and bleeding control. And bleeding control is silly. The CAD takes too long, it's too complicated, and we really don't use it much in EMS. However, joint immobilization and long bone immobilization are two that are usually used for that random basic skill, and the long bone makes you do a few more things, so that's usually the one that you're going to get tested on. So use this as a review and practice this again on family and friends as you're sitting around waiting to come back to school, and we'll have some more videos up for you pretty soon. All right.